heart of Yorkshire, our health service is hard at work.
Hello, Barnsley Casualty.
Help him!
The shoe axe, mate.
Ow, 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 ow!
A dedicated team.
You're strong.
You're the first person to say that. Oh, there we go.
Working 24 hours a day, 7 days a week.
If I run away. I think I've just about got it cracked, this job.
Ready for anything
Don't swear. What are you swearing for?
and everything.
Something clear?
I'm getting up on it, on.
Well, you're stuck with me now.
Wow.
I know.
Can't tell, boys.
Look at you, look at you.
Any pain at all?
No.
Facing life
We're back from the moon.
and death. Trauma
Oh, no.
and tears.
I'm not.
Supporting each other through the toughest shifts.
I just need the use of a cubicle.
I'm not going on any fucking water.
It hurts a tiny bit.
Oh, I love it.
It's like champagne. Baptism of fire into Barnsley, isn't it?
This is Barnsley Casualty 24/7.
God bless the NHS.
On shift tonight, Sister Jane Hawksworth.
I'm hoping these patients will have gone by tea time tonight, because otherwise they'll have trolley breach, hospital breach, every breach.
Consultant Dr. Chris Young.
What we're going to do now is we're going to take you around to have a CT scan. You need some pain relief before we go.
And advanced nurse practitioner Chantal.
It's working then, isn't it, that pen trap?
No.
So get ready to share a shift.
She's my bestie. I am that.
It's 7 a.m.
Hi, it's Jane.
and a new shift is starting for Sister Jane. Casualty is already full, and there are no beds available in the whole hospital.
There's nothing we can do.
Patients are facing a very long wait.
I know that the wards are working their way to try and get patients home, and obviously we have them still in the department. So all we can do really is feed them and make sure that they're comfortable. But we can't stop patients coming in, so it's just a backlog. It's a constant battle.
And there's no letter.
It's a laceration head and a possible dislocated left foot.
Another patient is blue lighted in. Waiting for the emergency to arrive is consultant Dr. Chris Young.
I'm the first member of my family to go to university, let alone become a doctor.
And he's one of Barnsley's own.
My parents are Yorkshire folks. They're very sort of down-to-earth people. I think they are quietly proud of me, of my achievements. Hopefully they are anyway.
76-year-old Mavis is in a critical condition, so he's brought straight to Resus.
Right, Mavis. We're going to move you on. This is Mavis. She was crossing the road and her car struck her. We think her right-hand side. She's landed 3 metres from the car, face first. We're on the floor about 40 minutes before we got there. She's got a large laceration just above her left eyebrow, grazed to the top, and then I don't know if she's got a fractured dislocated foot. Quite a lot of blood, to be fair, clotted everywhere.
We don't know how fast Charles is going.
The police said about 20 to 25 miles per hour.
This is being thrown now.
So she was on this side of the pavement, and
Yep.
she's landed against the other, so she's gone the full. Husband had been shopping with her. He went to put the shopping away, and then he thought, oh, she's been a while, and then went to slam the lid.
My concern for Mavis immediately is she could be bleeding internally, could be with multiple broken bones, problems if she's got lung injuries, okay, all these things are potentially life-threatening in someone like her.
Assisting Dr. Young is Dr. Kate Hargreaves.
We've got no obvious external hemorrhage. She's alert, orientated. Chest sounds fine. A small amount of left-sided chest wall tenderness.
Yep.
Belly's nice and soft. Moving all 4 limbs. Obviously got some laceration to my head.
Yep.
But nothing else like
Yeah,
that. The ridges in. I'm sure now, yeah.
Okay, good.
With potential life-threatening injuries, Mavis needs to be assessed straight away.
And if you just bring your teeth together for me, do they feel normal together? They do. I've even reacted when I checked initially.
It's an anxious time for husband Kenneth. While the team in Resus is trying to uncover the extent of Mavis's internal injuries, members of the support team, like volunteer Jane, are clocking on.
Good morning, dear. Morning, my love. You alright? Yeah, not bad.
She's seen Barnsley face unprecedented challenges over the last few years, and COVID has meant big changes.
So this is our new area. We've had to add extra cubicles because obviously the influx of people. I think every hospital's same. It isn't just Barnes, it's every hospital. It's just bigger now. I've just got to walk further. And not put as much weight on because I walk further. So we've got a little waiting area there. The patients, if they're fit to at least sit down, we can just pop them in there. We don't have anybody on corridors now like we used to. I mean, I can remember going back a couple of years, you'd always got people laid on corridors, on trolleys and what have you. We've got none of that. That's not allowed. Obviously, COVID's done away with all that.
But even with all the extra space, today the department is still under pressure.
How long are you going to be?
An ambulance is rushing in a 3-year-old toddler who's struggling to breathe. In resus, Sister Gemma Malpass and Dr. Louise Nugent are on standby.
Pop her on here for us. Hello, sweetheart. What's she called, Mum? Alethea. Oh, that's a posh name. Alethea has arrived into resus, and straight away I can tell that she's not behaving how we would normally expect a child to behave of her age. So she's not happy, she's not playful, and straight away I can see that she's in distress. I put this on your thing too, sweet pea. Oh girl, well done.
Woke up about 4 o'clock this morning, crying her eyes out. Mum and Dad couldn't understand what happened. She's gone back to sleep as normal, but when she got up this morning, she's had it. Better maybe got her 6 days. Really weedy all across. She looks a bit tired today and a bit muffled and very pale.
3-year-old Alethea's resting heart rate and oxygen levels are low. There's a risk she could have a serious infection. The team need to get her breathing under control and fast. At Barnes & Casualty, 3-year-old Alethea has been rushed into resus, struggling to breathe. With her is Mum Amy.
Can I have a little look at your tooth again? Do you make any difference?
At risk of a dangerous infection, paediatric registrar Dr. Ella DeZora checks her over.
Hey, Mum. Yes, my name's Ella. I'm one of the doctors. She's not had the X-rays before. Never had these before. Okay. You are being super brave. We're going to give you some more steamy medicine. The likelihood is that she's got wheeze because she's got a virus in her airways.
Do you want to see how she goes, Ella, without oxygen?
Yeah, please, yeah.
We've got a smile. Oh, yay. Yeah, that's better.
Alethea is also under the care of Sister Gemma.
Hi. Hi.
Something I've always wanted to do from being a little girl, really. I always wanted to be a nurse, and being a children's nurse is just being a natural thing for me.
You feeling better?
I find with children it's a bit more rewarding experience because you don't just work with the children, you work with the family as well.
You're going to have a bit more of your juice.
Good girl, well done.
She's maintaining her steps right, isn't she?
Yeah, she is, yeah. Thank you, obviously she's had all them meds, hasn't she?
Yeah. Some of these kids initially do quite well, but then get tired again, and we do kind of have to escalate therapy, and we just kind of keep a really close eye and see how she goes.
For now, Alethea's oxygen levels are stable. She's moved out of resus, but still needs to be heavily monitored.
I know it's rubbish feeling like you can't breathe properly. The breathing probably is a wee bit harder, isn't it? It's getting probably a little bit worse, isn't it? So I think probably we are going to end up with IVs for her, all right? We kind of try and make the experience as least traumatic as possible. So sometimes that decision between putting a cannula in is really hard. You don't want to jump in too early and really traumatise them for kind of next time they have to come in.
But with Alethea's condition deteriorating again, Dr. DeZora needs to give her antibiotics through an IV drip.
You are being so good and brave. Staying so nice and still. Last little bit, I'm just putting a sticky on, okay? Last little bit of being brave and still. Good girl. Nearly there.
The team will now monitor her closely to see if it takes effect. In the hub, Sister Jane is trying to deal with the effects of a bed-blocking crisis.
You've not had any hot meals come down for patients? No.
With no space on the wards, she needs to make people as comfortable as possible.
Do you know anything about any hot meals for patients that we've got down here? Because our patients down here, they're going to need a hot meal.
Yeah, my love.
I'm hoping these patients will have gone by tea time tonight, because otherwise they'll have breached. Trolley breach, hospital breach, every breach.
In Resus, 76-year-old Mavis is in severe pain after being hit by a car.
Are you warmer now, Mavis?
I can't find her all these blankets.
You're still feeling cold?
Still, yeah.
Have a finger there.
I'm not moving.
With the risk of internal bleeding, the team needs to find out the extent of her injuries quickly.
What we're going to do now is we're going to take you around to have a CT scan if you need some pain relief before we go. Yeah, we have some IV paracetamol as well. We're going around with that. Someone, as we're getting older into our 70s and 80s, even just a fall from standing can cause serious injuries from chest injuries, head injuries. So if someone's been hit by a car at reasonable speed, you've got to assume there's going to be quite a lot of damage happening.
Are we ready to rock and roll?
Yeah, indeed, yeah. Right, we'll see you in a minute.
All husband Kenneth can now do is wait. In the hub, Sister Jane is still wrestling with the growing number of patients backing up due to the lack of hospital beds.
He's the one with the atrial flutter going about 150. She's the one in cubicle A. I think she's quite stable. We're going to step these two down.
Including 50-year-old Chris, who's in Resus having been admitted with an alarmingly fast heart leak after feeling unwell at work.
I don't make a habit of going into hospital. My wife's a bit worried about me.
While he waits for X-ray results, Sister Vicky Walker checks in on him.
That's proper going for it, isn't it?
Yeah.
So what's doctor said?
Just running some more tests on me, see what I think it is, and then go from there.
Well, you're stuck with me now for as long as you're in here.
Wow.
I know.
I'm down blessed.
Look at you, look at you.
Doctors have reviewed Chris's X-rays.
There's just a little bit too much going on for me to say this is exactly what it is. So we just need to check the heart, we need to check the blood pumps, we need to get your heart rate down. So we're going to have
It's going to be days more than...
I imagine it'll be a few days. Just to warn you, the hospital's busy at the moment. So I'm going to apologise in advance that you're going to be with us longer than we'd like to be with us.
Chris's X-rays are inconclusive, and without a bed on the cardiac ward, the casualty team has no option but to keep his heart rate under close observation. With casualty gridlocked, Sister Jane is trying as quickly as possible to free up some space.
Lisa, you know the lady in cubicle high dependency 2?
Yeah, listening.
Yes, I don't believe she needs to be in there.
No, she doesn't.
So, I know she's waiting for a bed on AMU. So we can move her out and get that man in, can't we? Right, lovey, we're moving you out of this cubicle into a different cubicle. Just because I need this monitor in here for a gentleman that's coming out of Resus. I have no control over who comes through the doors, what they come through the doors with, how many people come through the doors. And we're never ever full. We are full, but we're never ever full because they just keep coming in and in and in.
On shift with Sister Jane today is advanced nurse practitioner Chantel.
Right, I'm going to pop these curtains round just so people don't think I'm trying to pull your arm off.
Hey, no.
Her next patient, David, has been rushed in by his wife, Donna, after dislocating his shoulder.
So how did it happen then? Exactly.
I grabbed my hoodie as I went to put one arm in, and then the other arm in, and it just escaped.
You have to try to put it on different ways.
A zip up. Instead of pull over.
Yeah, that's it, definitely. Be easier for you.
David is no stranger to Barnsley Casualty, after suffering with shoulder dislocations 28 times.
Been 6 times this year. The shoulder. 2014 it was 22 times.
Doctors have put it down to wear and tear from his job as a mechanic.
I just need to
You just need that.
get this one sorted now, because we can't be having this letting us down. No.
In severe pain, David is taken for an X-ray to assess if there's any tissue damage.
This is not strong now.
It's strong.
No.
medication until we feel it's safe. There's a threshold of what we can give, but we also have to explain to the patient that they will feel pain and that is quite normal and it is a painful thing, but we try and make them as comfortable as possible.
The results of David's X-ray could be life-changing. If he's suffered tissue damage, he could require surgery.
I'm going to get 17 up first. 19 can go, and then I'll get 17 up. And I'm just going to get that one out of resource. So there's 2 porters there. 19 look first.
Sister Jane is still struggling to get the number of patients down in Casualty. She needs to free up some space, and fast.
It's like spinning plates, really. You speak to the bed managers to see if there's any discharges. You go back into resource to make sure they're all right. You ask somebody to do your cup of tea rounds and sandwich rounds down in majors. Make sure assessment's okay. Go and see if there's anything you can do. It's like spinning plates.
Over in radiology, Mavis has had her CT scan and is taken back to resus. Dr. Hargreaves monitors her condition.
How's your pain doing at the moment?
It's in my back.
It's in your back. Yeah.
And obviously I'm frozen.
Come on, can we measure to him again? If it's low, we can get the bear hugger on.
Trying his best to comfort Mavis is her husband, Kenneth.
I'm going to measure that temperature again and try and get you a bit warmer. Just going to loosen one of these. Put your head nice and still for me. Get a nice warming blanket on you, I think.
Thank you.
You're welcome.
As a result of shock and trauma, Mavis's body temperature has plunged.
You're going to wish you'd got one of these at home.
To prevent potential organ failure, nurses Lisa and Mimi warm her up with an inflatable blanket filled with hot air.
Lovely. Off we go. Okay. What temperature? High, low, high.
You warm now? I want to come home now.
It feels lovely.
We have young men who come in with less than half injuries at this young bumps, aren't you, maybe? Typical Barnsley lass. Hard as nails.
Mavis might be warmer, but she's not yet received the results of her CT scan. In the resus hub, advanced nurse practitioner Chantel is looking at patient David's X-ray.
This outlook. So it should be in this nice little notch there, and it's just at the front and at the side. So we need to pull it back and get it back in there.
Despite the drugs he's been given to help, the pain is becoming unbearable.
Spasming. The relief, as soon as it goes back in. Lift her body up. I'll need another one of these before they do it.
He asked me to help him put it in this morning, didn't you?
Yeah.
I can't do it. I don't like seeing him pain.
Right. Are we ready?
Ready.
Get your eyes. Can we try and get you so relaxed?
He's been given the drug Penthrox in an inhaler to help relieve the pain.
So I want big breaths.
Yeah.
No little mouse ones, I want big breaths. That's it, it's working now, isn't it? Feels less tight now.
Nurse Chantel begins manipulation.
Heave!
It's working then, isn't it, that Penthrox? So this is just stretching and relaxing that muscle arm.
But David's shoulder is proving difficult to put back in place.
Breathe on it.
No.
Breathe on it.
No. Pain. No. No.
You're doing really well, honestly. It's moving. Sedation, I think it's 210. The muscles around the joint can tense up, which makes it quite hard for that joint to relax. Move a little. I know. Some people can handle pain really well. Sometimes the strongest of people have to succumb to a few tears.
If they can't get the shoulder back in, he'll need to go to theatre. Towards the casualty, Sister Jane is halfway through a very tough shift.
Just no movement. They'll move 5 at a time. So I have 11 patients waiting for beds. The worst aspect of bed blocking is that the patients that are in the department need a bed and can't have a bed because there are no beds. I think orthopaedics have got 2, surgery have got a few. There's no beds on stroke, I don't think. Jane's been down.
I think those that can go in chairs, like Katie's just took one up herself in a chair. Those that can go in chairs, we get them up in chairs.
Over in Resus, 76-year-old Mavis is waiting for her CT scan results after a car ploughed into her while she was out shopping.
On that scan you've just had, your neck's absolutely fine. All of your body's absolutely fine. There's no bleed in your brain or anything like that. They think you might have broken just the bone along the side of your face there, but I hope that that will just heal on its own. I'm going to have a chat with the specialists, but there's nothing that is untoward at all on that scan, okay? So what we're going to do is slowly, we're going to get you out of all of these blocks and things and let you sit up a little bit and see how you feel.
Whilst not life-threatening, Mavis does have multiple injuries to her head, face and hand.
Okay, should we stop there for now?
Yeah.
Right, we'll want a couple of stitches, okay? It's all the way across your eyebrow. So we want to get a nice finish for you. And you need an X-ray of that thumb as well, don't you?
Yeah.
Yeah.
Don't slip downside.
What comes from that? Some dry blood on your lips there.
Have we got any allergies up in there, Ben?
Only my husband
Only you, oh, it seems like a good one.
is.
Oh, how long have you been married?
How long have we been married then?
57 years.
57 years, that's
Oh,
it.
goodness me, congratulations.
20 of them's been happy.
You're a dinner lady at school?
Yeah.
Sure, a dinner lady.
I used to be in a past life. Did you? I did. I'm a lollipop lady.
I'm really sorry, darling. I know it's going to be a little bit temporary.
Yeah, it is actually.
Sorry, sweetheart.
I'm not coming home and it's lovely and warm and
She's stopping in this bed, Ken.
Yeah.
You've got bed to yourself tonight, love.
A full bed instead of a third.
With treatment still needed, Mavis heads for an X-ray on her damaged thumb.
see you in a bit.
Okay. Behave.
Something on here for us?
3-year-old Alethea was rushed into casualty struggling to breathe.
Right then.
After being given an IV drip, her oxygen levels have improved and breathing stabilised.
I'm gonna go for a little ride, sweetheart.
Now the team can move. After 2 days of being monitored, Alethea was released, fully recovered. Nurse Chantel is trying to get David's dislocated shoulder back in place.
No. Hey, no.
I know, sweetheart. Listen, relax your arm. You'll thank me when it's in. So when you've got a patient that's quite distressed and you know that you're inflicting pain, your automatic response is to stop. But I think you look at the end goal of getting that joint back in and then you know the relief. When that joint's back in, the patient's comfortable.
It's looking more likely David will need to be sedated.
You've been sedated before, haven't
Yeah.
you? You did well, though. You did really well.
Dr. Young is on hand to see if he can help.
What have we tried so far?
He's had some traction, rotation, and anchoring.
We can try without sedating you. I'd like to give it a go. Yeah. One thing I needed Dave to be was more relaxed. But if we can distract him from what's going on as well, then that's going to make life easier for him. It's going to make my life easier and allow me to do what I need to do in order to get his shoulder back into joint. Get you sat up a little bit. Your family?
Right.
You do it.
No, I've no involvement. I'm upstairs getting ready for work.
Damn it. Put it on top of my shoulder. Yeah, that's the perfect one. When was the last time it was out?
The last time. 6 months ago. Yeah.
So why it just suddenly started happening?
No, just said it was like the lawn with my job and
Okay. What do you do?
motor mechanic.
Yeah, okay, so you do a proper job.
For the last attempt, Dr. Young is trying a different technique.
It's not feeling. Oh! I don't feel relaxed. I'm tense.
I know you can feel it. There are as many different techniques as you can possibly imagine to put a shoulder back in. We all have our favourite. The pain causes them to go into more spasm. So if you're a bit more gentle with it, often you get better results, which seems like the wrong way to think about it.
It's not doing it.
It's alright, okay.
I'm hurting a lot. I just want it in without this pain.
Feel it?
Yeah.
Alright. As a consultant, I've got to admit, I enjoy putting shoulders, etc. back in. You can see the relief appearing on people's face. That's fantastically satisfying, and that's one of the joy. Push against me. Yeah, push against me.
Hold on, Chris. This should be going on quicker now.
Yeah.
You keep your arm, and I'll...
Got it.
You want it to come back out again, do it? I think Chris will not be happy with me if it pops back out again after. Dr. Young came to my rescue. However, I'll take full credit that I probably helped the joint. I prepped it very well for him to then just come in and take over and get the joint back in. No, I'm kidding. Right, let me order you another x-ray. Okay, if we're in position, everything looks nice, then you can go home. Alright, perfect.
David was given the all clear from his x-ray.
So it's out before, and it's back in its little pocket now, so it's back in.
And was able to go home that day, but his arm could take 16 weeks to fully recover. In the hub, it's one out and one in.
Do you feel a bit calmer now, sweetheart?
8 hours after arriving with a rapid heart rate, Chris is moved from resus to a cubicle until there's space on the ward.
Nothing's changed at all. Just kept coming in and give me another drug, and that's not worked. And you're looking at the screen above you there that's telling you exactly the same as one behind you. So you know what it's, you know what your heart rate is, and it's just a case of trying one after other until one takes and brings my heart rate down, I think.
So actually it's you that's awkward, isn't it?
No, has it been? Any bit of that?
Because we've given you loads of drugs and it's not worked, has it? We gave you loads this morning and now we're working. And you're still trapping away, so...
I believe in getting me money's worth. I'm a typical Yorkshireman.
Right, there you go, love.
Thank you very much.
Alright. It is important to have a sense of humour. We take the mickey out of each other to try and make other people laugh.
Hey, love, you alright? Yes, thank you.
And volunteer Jane is always on hand.
Bit bored, are you?
10 hours.
10 hours? Good grief.
I'd be ready for another cuppa before long then. It is quite important to try and keep a patient's spirit up. I think the thing that will always be guaranteed to put a smile on people's faces is a cup of tea. That would be better if we could have a tot of whiskey in it, but unfortunately we're not allowed. I'd like, I could have a cup of chocolate mocha, whatever it is.
76-year-old Mavis has had an x-ray on her badly damaged thumb and is heading back to resus. Dr. Maz Yousafpour, a specialist in facial injuries, arrives to assess the deep lacerations on her face.
My name's Maz. I'm part of the All My Station.
You get it there, aren't you? I don't know, that's painful to somebody. Well, I'll try and be brave.
It really needs that little dressing that's on the side of your face. Is that okay? Are you comfortable?
Just pull fingers a little bit.
And let's have a little look. Yeah, so
That's sore.
that's sore here. Okay. Up here as well.
No.
And so here, which is understandable, you've got quite a bit of swelling in that area.
Dr. Yousafpour starts to stitch Mavis's wound.
Not scratch. Okay, is that right? Sharp scratching it. There we go, well done. Any pain at all?
No.
There's no injury to the eye, so that's obviously the most important thing, isn't it? There will be a scar at the end.
I think she's doing very well. seems to be just telling him they can get on with it. He's much tougher than I am. Can't be easy. 6 different parts of the body, isn't it? It's not just one specific thing. Very proud of him.
Mavis, we're all done. So what we'll do is we'll see you again in 1 week's time, and we'll remove the stitches because we only want them to stay in for 7 days, and then we'll review you regarding your facial fractures as well, just making sure that everything's okay.
Right, thank you very much.
Is that all right? No problem at all. Take care.
But Mavis's urgent medical care is not yet over. Her hand is so badly injured, she needs specialist care to avoid long-lasting damage to her thumb. Back in the hub, the hot meals that Sister Jane has been chasing have finally arrived. But it isn't just the patients who are in need of some sustenance.
I've got a tub of sweeties. We can share these sweeties out. Right, ladies? There you are. Let's go distribute some more out. Or else there'll be trouble. It keeps their energy levels up. Keeps them in good books, doesn't it, Anita? So I'll leave some there. Take some down here. The sweetie drawer is quite important. It's a staple of his diet. It makes it feel as if they're being thought about. They don't get a break if it's really busy, and that sweet sometimes makes all the difference.
Oh, and I like eclairs.
I like Turkish delight, but no bugger buys me any. No problem, my darling. I can just keep you going a bit longer, wouldn't it? I better take these to other bits, haven't I?
As the shift continues, so do the 999 emergencies. Dr. Asim Salim heads immediately to Cubicle 1 to meet Ralph. Student nurse Ashley hands over.
For this job, I won't be pain in his chest. Contact your GP or advise him to contact 999.
So your ECG looks a bit abnormal to me, right? Okay, yeah. So what we'll do is, we'll repeat your ECG and then we'll figure out what we're going to do next. He is somebody who looks not extremely poorly, but still has chest pain, and he has a very abnormal ECG. So you can still have an heart attack when you don't look very poorly, but actually you are. So that's the danger with that.
Student nurse Ashley starts the second test, while Dr. Salim prepares resus.
Any space here?
There is space here.
As Ralph could be having a heart attack. In Casualty, Sister Jane is still struggling.
57-minute wait, Doctor. Yeah, breaches are due to no beds.
There are 53 patients in the department, but those in need of a bed still have nowhere to go. Some have now been waiting for up to 8 hours.
There's just no space. There's 16 medical beds overnight. I've got 13 waiting for them.
So we've got 1 female bed in there?
With no female beds. We've got 3 male beds, that's it.
In Cubicle 1, Ralph's follow-up ECG results are in.
Look.
Dr. Salim gets a second opinion from Dr. Newton.
Yes. Yeah, let's move him to recess. Let's print one quickly and then we'll move him to recess. So that is the test of my driving skills. Can you put him back on the monitor now, please?
Why did you make sure?
Because the doctor told me.
Why did you go to the doctor?
No, that's not any chest pain.
Oh, what is it?
Just a general ache in that area, you know.
So a general ache in the middle.
And then just when I breathed in,
Yeah.
it was more of a sharp pain.
How old are you?
81.
What's your secret?
Where'd they go?
Ralph's given another ECG, which will be sent to the nearest specialist heart hospital for analysis.
We have sent the ECG to Shuffle. They will show it to their team, and once they agree, they will ask us to send him across to Shuffle, so he'll be blue lighted to Shuffle. So let's do another ECG.
So you're picking him up from the resus unit at Barnsley Hospital?
patients like that, I mean, they benefit massively for early assessment, like, so when we saw him at 0 minutes when he arrived, all the tests done, referrals done, and he had bypassed the whole queue, seen, sorted, referred, because again, we don't have much time with a heart attack, which we believe he's having.
After being transferred to the Northern General Hospital, it was discovered Ralph has pericarditis, an inflammation of the sac that surrounds the heart. Since visiting Casualty, he's been back a number of times and is now taking a new heart medication. Still in resus is 76-year-old Mavis. At risk of losing her thumb, she's waiting for the results of her X-ray.
Are you ready? I think the thumb man comes. He'll numb it for you. I'm telling you. He'll numb it for you.
Orthopaedic surgeon Mr. Khan is the 6th specialist to treat Mavis today.
Hello, Mavis. Oh, bless you. I heard that you were injured. You were knocked down by a car. Now, what I could see on your x-rays is your joint is sitting out of socket and there's a bit of tear on the skin. I'll give a bit of local anesthetic to make it numb, okay? And then we will just try to push it back in place. We'll look after you, okay? So just to bring your hand up, you don't have to look at it. You can just look away. I will. Okay?
Well done. Mr. Khan must realign the thumb as quickly as possible.
Skin in Mavis' age group is quite fragile. So we just have to make sure inside pressure it doesn't lose its vitality and dies out. And if it dies out, there will be more complex treatment, and some people do end up losing their thumb. So Miss Mavis, it's gone a bit numb?
It has gone a bit numb, yeah.
Brilliant, brilliant. Okay, just relax now. Okay, now are you strong enough?
I don't know.
How does it feel?
Okay, just stinging a little bit.
Yeah. Just relax now. That's gone back now.
Oh, is it good?
Yeah, look, it's gone straight. Okay?
Good. Let your fingers.
You can move the thumb now. It was like a...
Oh, yeah, you can.
Done it before.
Oh, yeah, that's brilliant.
But the job is not completely done yet. You just have to take it to theatre, wash it properly, and suture it. Okay? But for the time being, the pressure that was on your skin is taken off. Skin would have gone black, save the skin around it, and save the joint for the time being. Thank you. Do you want silver grip on that? A woolen crepe bandage?
Yeah. Not coming home.
After having her thumb stitched, Mavis was admitted to the orthopaedic ward and was released home to husband Kenneth 5 days later.
Turn left.
With just a few minutes left of her shift, Jane stood desperately trying to admit patients.
Lovely. Thanks very much, darling. Bye. Patricia is ready to go. Lovely. Let's get a porter and we'll have a qualified nurse. There's a lady in cubicle 4 who can go as well, so 3 and 4.
After waiting for 10 hours, it's good news for Chris too.
Right, Christopher can go to the ward. Come on down. Come on. The lovely gentleman in High Dependency 2, Christopher, can go up to AMU. Would you mind taking him as and when we get a porter? All right, he is monitored. He's very pleasant. He doesn't look it, but he is. Sometimes 4, 5, 6 beds can just keep coming up together, and although the patients are all ready to go to the ward, the frustration is then not having the staff to be able to take them up to the ward. The amazing thing about it is, though, it happens. You do manage it.
Chris was admitted to the cardiology ward, where it was discovered he had an enlarged aorta. He's currently awaiting surgery. It might be the end of Jane's shift, but the patients keep on coming.
A&E Barnsley. Okay, go on then. 81 female. That's fine. Do you want to come through assessment? How long are you going to be? All right, lovely. Cheers, bye.
And the night shift team is ready to take over.
There's one coming through the hub. She's red flag sepsis, 81-year-old. Previous sepsis 6 months ago. At the end end of a busy day. I think that's been a grueler. I want to go home. I've had enough now. Go home, cup of tea, some food, in a warm house, a bath and go to bed. And just try and relax your mind a little bit.
But no matter how tough the shifts get, the doors to Barnes and Casualty have to always remain open. Next time on Casualty 24/7.
There's a tree across the road that's been uprooted.
Oh my god. Oh,
I wish I'd never gone out of bed this morning. I was safe in bed.
the big tree.
Dobson's way. Check if you got a brain too.
Yeah.
David?
And you can see that next Thursday at 9. Going back to his roots to reveal his ties to the unique history of London's major trauma teams racing to provide life, safe and care at the scene. Ambulance Code Red is new. Next.